We should have some background music, don't you think?
Yeah, get some nice jazzy tunes or something like that to welcome folks in.
Or a BCMPHA and AMA theme song. Do we have any talented musicians out there?
Well, I think we might as well just get started. I imagine some folks will still trickle in throughout the start of the session here. But I'll just begin by welcoming everybody to the webinar. So I'll give a brief introduction. I'll pass it over to Marika and Celeste just to say a quick couple of words, and then I'll pass things over to Marsha and Brayden, our wonderful presenters. But good morning. I'm Jackson Friedman. I'm a policy analyst for the BCMPHA. I'll be sort of a moderator for today. I'll do this introduction and then I'll pop back on for the Q&A towards the end of the session. I'd like to welcome everybody to the afternoon or to this morning's session, which will be facilitated again by Marsha and by Brayden. We'd like to acknowledge that the session is being delivered from various locations on the unceded traditional territories of the Coast Salish people, home of the Musqueam, the Squamish, and the Tsleil-Waututh nations. And we acknowledge that many of you are currently located in the ancestral homelands of Indigenous people across the province, each with their own unique traditions and history. And so at this point, if there's any technical things that arise, please send a message to me through the chat. I'm kind of, our Zoom host for today. I'll see if I can help you out in the background. And if not, then I'll just direct you over to zoom.us/support. I'll give a brief outline of the format of the presentation now as well. So the presentation should be, and Marsha and Brayden, correct me if I'm wrong, but around 60 minutes or so in total. And then we'll follow that up by an open question and answer period. So you should see a little Q&A bar at the bottom of your screen here in that little bar of options that Zoom likes to give us. So feel free to use that to put your questions in. And then towards the end of the presentation, we'll make some space to make sure that you folks can get those answered by our panelists. We are recording this. The audience is muted, which means that you folks can hear us, but we won't be able to hear you. So using that Q&A feature or the chat feature, which you've already so successfully tested out for us, thank you very much, will be a good way to get in touch with us while our presenters are presenting. We'll also make the recording of these webinars, of all of our online learning stuff, available to our participants in the session. So if you miss anything today, don't worry, don't have to take too copious notes. You'll be able to access it all later. And before we start, just one more note that I'd like to thank our BCMPHA education partners, one of whom is AMA. And so thanks Celeste for being here, whose support enables a lot of our online professional development opportunities for the community housing sector. Mm-hmm. And I will now introduce our presenters. So we first have Brayden Volkenant. He is currently an associate lawyer at Dejager Volkenant. He completed his law degree at the University of Alberta in 2018. And he works closely with many society, charity, and housing provider clients to help them resolve their disputes, primarily in the areas of employment and human rights, as well as in the tenancy context. In his spare time, he enjoys watching and participating in a long list of sports, especially soccer, and spending time with his wife and 4 kids. We also have Marsha, a seasoned presenter with the BCMPHA. She's a chartered professional in human resources, 15 plus years in management of nonprofit housing and residential tenancy programs, and over 20 years as a senior level HR and training practitioner. She has practical experience in the sector, having worked as a director of operations for Capital Region Housing Corp, and serving on a number of nonprofit housing and social services boards. She's currently the president of Progressive Housing Society in Burnaby. And so now I think what I'll do is I'll pass things over to Marika and Celeste to say a couple of words, and then we'll have them pass things over to our presenters. And I will fade into the darkness here, and I'll be back for the Q&A. Thanks very much, folks.
Thanks, Jackson. And I promise I will just a couple of words. So I'm Marika Albert. I'm the policy director here at BC Nonprofit Housing Association. I'm also calling in from Squamish, Musqueam, and Tsleil-Waututh territory, and I'm really grateful that we're able to do the good work that we do to support our members like you in providing affordable and accessible housing. And I'm thankful that you're all able to join us today. We were able to join up with our partners AMA to have Marsha and Brayden develop this vaccination guide for us. We've heard from our members that we were really looking for some guidance around this as the vaccination process is rolling out. So we heard you, and here we are today. So thanks all for joining us. Celeste, did you want to say a couple things?
Thanks, Marika. Hello, everybody. My name is Celeste Hayward. I'm the Director of Operations at AMA. Fairly new to the position, started in November, so I'm still learning everybody's names and what anything means, I guess. I'm originally from northern British Columbia, Wet'suwet'en Nation, which is up near the Smithers Woodsett Houston area. And I am currently in the traditional lands of Treaty 7 and Region 3 for the Métis, and really excited to share this knowledge that Marsha and Brayden have pulled together for everybody and send it out. And this is going to blow your mind. Thank you.
You go.
Great. Yeah. And now over to you, Marsha and Brayden.
Okay, so if everybody would please mute their microphones and turn off your video. I'm going to share my screen. Sorry, I think I was sharing it earlier and didn't realize it, but here we go. So the first thing okay, hold on, let me just get this presentation going. Okay, the first thing I have to say is we really have to stop meeting this way. Last year at this time, I did a webinar on the safe return to work for phase 2, I think it was, in the BC plan for return to work. And here we are again. I don't think we really thought that, well, at that point, I don't think we thought this would last that long. So I'm going to, let me just see what I can do here. You'll have to excuse me because I do have to consult my notes at some point. So I'm going to have to move my, there we go. Okay. All righty. So what can you expect to learn today? Well, in terms of learning outcomes, we want you to know about vaccinations and why they are important. We want you to understand, in particular, the COVID-19 vaccines and the vaccination program that the province is administering currently. We need you to be aware of vaccine hesitancy because you're going to run into that if you haven't already. Reasons why it exists and how to encourage people to get vaccinated, even if they're hesitating. You need to understand your legal rights and obligations, both as an employer and as a landlord. I'm going to cover the employer side, although Brayden is an expert on the employer side, so he will supplement what I have to say. And also, we want you to be aware of some of the steps that you can take to combat COVID-19, primarily focusing on the vaccinations, of course. So here we are 1 year later. I just want to turn your attention back to May of 2020, at which point the International Monetary Fund said that growth in advanced economies would not get back to its pre-virus peak until at least 2022. I think at the time we thought that's crazy. I don't think we think that way anymore. They said that quarantines and social distancing measures were vital. Upfront containment measures were essential to slow the spread of the virus, and we have found that to be true. There would be uncertainty and reduced demand for services, and it could be even worse if people fail to socially distance. And it urged the world to work together to find and distribute treatments and a vaccine. And of course, at that time, the notion of having a vaccine available was, I think, felt to be at least at a minimum 18 months. So what we know now, having gone through this past year and 6 months or so, is about 1/3 of the cases that we've encountered are asymptomatic, which means people show no signs of infection. And that is truly a dangerous scenario because people go out and do things and feeling that they're quite safe. And then you have a whole slew of people out there that believe the whole thing is a hoax. So those are not helpful, obviously, in containing the spread. There are currently 4 variants of concern in BC, the UK one, the one from Brazil, South African, and India. We know that in the past week, the number of new cases, active cases, hospitalizations, and deaths have gone down steadily in BC. That's good news. We know that while we still have safety protocols and restrictions in place, that we are able to contain the virus and hopefully continue the downward trend. And we also know that our governments are continuing to provide financial relief, which is really helpful to individuals who are looking at reduced work or job losses or temporary layoff. So just in terms of the world situation, you can see there are still a lot of hot spots. The lighter areas do not show evidence of cases. You can see Australia and New Zealand have done very, very well. China is almost, I saw some news coverage the other day, which showed that China is almost back to normal. And then of course, the areas of concern still are Europe, Eastern Europe, Asia, South Africa, and then still Canada and the US are still facing large numbers, large cases every day. So in Canada, you know what, I'm not even gonna give you the numbers except to say that it's about 1.3 million confirmed cases with just around 25,000 deaths that had been reported to the WHO at the last reporting session. As of May 10th, happily, over 16.4 million doses of the vaccine had been administered. 1 million individuals, or just under 3% of approved recipients had been fully vaccinated, meaning they've had both shots. Sorry, I'm just consulting my notes as we go here. Okay, so here is the progression of COVID from day one in BC. And as you can see, way back in late January of 2020 through to early March, there were only a few sporadic cases of COVID identified. Then from March through to mid-May, the number of cases kept rising steadily. From mid-May, the number of daily cases and deaths and hospitalizations remained steady, relatively flat. We thought we had things under control. From mid-July to late November, there was a general rise in cases, and it plateaued in September. And then we've had a major spike. And that is not just in BC, but it's across Canada. So that prompted the province to start declaring further restrictions. And I know in other provinces, those restrictions have been even stricter and more stringent than they are in BC. They've had much more of a lockdown than we have had here. And which is, you know, we've basically been allowed to live fairly normally with fewer restrictions. And obviously our industry or our sector has continued to work because of the essential nature of the work that we do. So you can see as of October, the spike started. Deaths usually lag about 3 weeks behind cases, identified cases. So currently we are starting to see a decline, and hopefully, and actually these numbers are starting to go down. I have to say, this has been quite the challenge because every day there's been new information. Not necessarily, you know, life-altering information, but just in terms of the progress of the virus and the progress of vaccinations in BC and the change in supply and all that. So it's been a bit of a challenge keeping this, I think, in mid-April. So every day it's been, yeah, a new experience. So here is a graph showing people who have received vaccinations in BC and the timeline. And as you can see, we're really starting to progress in terms of getting the shots in people's arms. And as the supply was received and the province started to administer. And also there was the decision to give everybody a first shot and to delay the second shot. So that meant that more people could get their first shot. Bonnie Henry who has become a household name, Dr. Bonnie Henry, says that we've been building a spaceship as we've been flying it. And now we're entering into a new era, a new warp speed, if you will. Dr. Henry says, and that's what she says about the supply bonanza. So basically, Canada had a kind of a faulty start. We didn't get the supplies that we were promised. We don't have a supplier or producer in Canada to be able to control the production and supply and administration of the vaccine. So we've had to rely on external sources. So what is a vaccine? This is really a fundamental question. And vaccines are different from most medications in the sense that they are a biologic drug, which means that they come from living organisms. They are made up of small amounts of weak or dead cells, germs that can cause disease. So in this case, it would be diseases that would cause, it would be the coronavirus. And they are typically larger and more complex than chemically produced pharmaceutical drugs. So that's an important thing because, you know, especially in this scenario where people are getting vaccinated and we're seeing the evidence of how it's working day to day. So it wasn't obviously until we had some evidence that showed that the vaccines were efficacious, that they worked, that they were safe, that they were actually approved for use on an emergency basis. So how do they work? When a vaccine is administered, it causes the body to build an immunity to a specific disease, in this case, COVID. It helps the body fight the disease faster and more effectively. A vaccinated person can be exposed to the disease without being sick, without becoming sick, or if they do become sick, without the risk of severe illness, hospitalization, and in the case of COVID, death. So vaccines do save lives. Over the course of the last 50 years, the Canadian government has sanctioned and administered vaccines, and they've been shown to be very effective in preventing illness. And when you give them to large numbers of healthy people, it controls the actual transmission of diseases. And so we've seen real success in terms of vaccines for things like epidemics like Ebola, childhood diseases such as polio, measles, mumps. Basically, you never hear about mumps anymore. It's almost been entirely eradicated in North America. They've been successful in containing diseases like yellow fever and other forms, and influenza. So we have flu vaccines every year. And also vaccines have been shown to be effective in preventing and treating cancers. So one of the big questions is, how safe are they? And the reason I'm providing you all this context is because we need to be ambassadors for vaccinations. We're not going to get through this pandemic without people taking the safety precautions they need to take. And of course, the most invasive or intrusive one that you're asking people to take is to be vaccinated. So you really need to be familiar with, and the guide provides a lot more information than what I'm giving you here, but it's really important to understand what vaccines are and how they work and how safe they are. So it's important to know that the vaccines that have been approved in Canada go through a rigorous process of testing. They're highly regulated to ensure that the evidence is constantly monitored so that people can determine what kinds of outcomes and side effects there might be. They're continually monitored for safety, for efficacy, and for quality. There are the systems in place that do the monitoring, the tracking, the reporting. And if evidence suggests that there are side effects that may cause harm, then the government, the health authorities, our public health authorities, place restrictions on their use. And in our case, it would be the CDC, Canadian Disease Control Center. So we've already heard of situations with AstraZeneca And then in the States, the Johnson & Johnson, alias Janssen, vaccines being shown to cause blood clots. It's also been shown that these instances are extremely rare, that they occur less than the rate of people taking birth control, for example, and other kinds of medication. Nevertheless, there are actions being taken to control, either pause, stall, further regulate any vaccines that show any evidence of harm. So it's important to know that. In BC, we have a 4-phase rollout for administering the vaccine. We have completed phases 1 and 2. Basically, those were high-risk populations, people in long-term care facilities, whether they were residents or staff, any individuals that were awaiting long-term care who might be at home, but obviously vulnerable to disease, any essential visitors to care facilities and assisted living, congregate living facilities, hospital workers, and paramedics, people who are providing emergency care, and remote and isolated Indigenous communities where the threat of an infection could pretty much cause harm to the entire community. So phase 1 happened, it was completed in February, and then February through April, the next group to be immunized were seniors born 41 and earlier, again, Indigenous nations and people in those groups that were prioritized, hospital staff, and again, vulnerable populations living and working in select congregate settings, and staff in community home support and nursing services. So phase 1 and 2 are pretty much complete. For anybody who wanted to get the vaccine, they would have gotten their first dose at a minimum. The current phase that we're in actually started earlier than projected, so probably started in mid-March. And so you've got the phases, those timelines for people being vaccinated go by age in 5-year increments, starting from the age of 76. And now we are into phase 4, where we are vaccinating people in their 30s. And anyone who has who's immunocompromised. Excuse me. So I want to talk a bit about vaccine hesitancy, because it is something that you are going to encounter. It's very real, and people have their reasons. So even with the vast amount of evidence that's out there, there still exists this level of hesitancy. And so people who do not want to be who do not want to be vaccinated or refuse to be vaccinated have their reasons. And we know, we've dubbed them anti-vaxxers. You know, there's a reluctance or refusal to be vaccinated or to have their children vaccinated. So what are some of those reasons? So first of all, one of the biggest reasons that you may encounter is there's a general distrust of big pharma and the profit motive. So, you know, people will always question who's really driving this bus. And in this case, you've got the major pharmaceutical companies around the world who have been approved and are benefiting from the vaccine. Although it's you know, it's great work that's being done. So I'm not in any way diminishing it. The speed of development of the vaccine, people may feel it was too fast. Some people want to take a wait and see approach, and that's totally understandable.
Giving a seminar on vaccines.
Sorry. Okay, so then there's a risk of serious.
7 o'clock tonight is that rally.
Sorry, Lila, you need to mute.
I'll call you. Okay, bye. Be about an hour. Bye.
Oh, sorry, Lila. Please mute your mic.
Oh, I thought it was muted.
No.
Oh.
Thank you. Okay, so the risk of serious side effects. So obviously we've heard about that and people are concerned about it. Women who are looking at having children are concerned about the possibility of sterility. And we just don't know at this stage, but the evidence suggests at this point that this that these risks are extremely low. There's a risk, there's a a reluctance or a hesitation on the part of certain populations who have faced systemic discrimination and racism in the past. And a lot of this affects the Indigenous communities. So it's important to understand why people in Indigenous communities may distrust government because of the history that they have in terms of vaccine administration, and in some cases feeling like they were guinea pigs for testing and determining outcomes. So, or not being vaccinated properly. So, you know, the thing is that you need to understand, and I'm sure anybody who works in the Indigenous sector with Indigenous populations will be sensitive to people's concerns around that. There's a belief that vaccines cause deformity, brain injury, type 2 diabetes, seizures, and other chronic conditions. This is largely being proven to be untrue, but nevertheless, people do believe it. There is a belief that vaccination goes against God's will, that it's against human medical intervention should not take place. God's will should supersede. And there are people who make a political stand, basically my body, my choice. So they resent government interfering in any way with their freedom of choice. And then there are the conspiracy theories that we've heard about, particularly about COVID. The fact that some people feel the whole COVID thing is a hoax, that the government is tampering with your DNA and that they're injecting GPS tracking devices into your system so they can follow you. So you've got all manner of concerns that people have and that they're going to raise. Some of them are legitimate. Some people actually have medical reasons for not wanting to be vaccinated, and it's important to respect those reasons. And if you get information about that, to protect the information. So how can you, as employers, as managers, combat vaccine hesitancy? Sorry, I'm just going to look to my notes here. So the most important thing is to provide information, get from reliable sources. So we need to keep in mind that the pandemic is not going to end until COVID has no opportunity to be transmitted. So that means that a certain number of people have to be vaccinated. So you have to be able to tell people what are the benefits of being vaccinated, and they need to be able to get good information about the evidence, you know, the fact that there are no visible, no common side effects to being vaccinated. We need to show that the vaccinations are actually showing results, that they are curbing transmission. The benefits of being vaccinated, you can tell people what those are. It protects against severe illness and death. It may not stop people from getting sick, but it certainly prevents hospitalizations and potential death. Fewer cases obviously reduce the burden on the healthcare system. We've seen, and I can't imagine being in the system and having to work with people every day and see the kind of repercussions of serious illness and death and not feel like there's anything you can do about it. So it's just been totally debilitating for people for our healthcare professionals and people in essential services to watch and feel helpless about it. So obviously, as we curb transmission, we'll be able to lift restrictions and we'll be able to get back to whatever normal looks like in the future. Now, this is a really, really important slide. This is Prince Rupert. And this basically shows, I have to slide myself here, that in February of this year, they were starting to go down a bit of a decline. And then in February, like the rest of us, mid-February, mid to late, we started to see a spike in cases. And so this shows the progression of cases for Prince George from February 13th through to beginning of May and beyond, actually. So around March 13th, the population started to receive vaccinations, and then there was the 14-day period during which vaccinations actually take effect. So 14 days after approximately 85% of Prince Rupert adults got the shot, you start to see an incredible decline to the point where there is practically no evidence of COVID amongst the adult population. And of course, it doesn't affect kids to the same degree. So that's a really important slide. And you're going to see more evidence of that. In the guide itself, we provided links for you so you can check the daily numbers. These to me are the best, is the best way of conveying the importance of vaccinations. So check daily. So now I want to get to the core of the presentation. I'm sorry that took so long, but it's really important to provide the context around this stuff and for you guys to know where you can go to get good information and be able to provide that information, communicate it to your employees and to your residents. So I'm going to cover the employer side. I'm going to talk about the rights and obligations for you as employers, and then Brayden is going to cover off rights and obligations for you as landlords. So some of the key questions that you probably have, the first and foremost being, can you force your employees to be vaccinated? Can you demand proof of vaccination? What can you do if someone refuses to be vaccinated? Can you treat unvaccinated employees differently from people who have received the vaccine? And are there any alternatives to vaccination that you can enforce? So, can you force your employees to be vaccinated? In Canada, there is no mandated vaccination. There never has been, and there likely never will be. So you cannot force individuals to be vaccinated. At least the government does not mandate it. You can, however, as an employee, and I'm going to talk as an employer, sorry, I'm going to talk about that later. You can have a mandatory vaccination policy, but there are a lot of caveats around that. And of course, you would need to seek legal advice. So I'm going to leave some of that to Brayden, but just important to note that there is no legal precedent at the current time that allows you to make being vaccinated for COVID-19 a condition of employment. Okay, so keep that in mind. So if not, what can you do? Well, the first thing you need to do is provide information, as I mentioned, on from reliable sources on a regular basis. And in the guide, there's a link to the Johns Hopkins Medicine on COVID-19 vaccinations that explains what the various vaccinations are. So provide information on the vaccines themselves so people understand what a vaccine is, just as I've done here earlier, so that people, you know, the word just doesn't become so common that it loses its meaning. Then share the evidence. Share the slides like the one I just provided on Prince Rupert. Anything else that comes out in the news that demonstrates the efficacy and the safety of vaccines and the importance of people getting them. So there are a lot of links in the guide that BC Nonprofit and AMA are providing to you that will allow you to obtain up-to-date information on a daily basis. I would suggest that you share that information with your employees, even those that have been vaccinated, to reassure them, because they're going to run into people who will hesitate as well. And you want to be able to give them our ammunition and to be ambassadors for the vaccine by just sharing that kind of information that it's easy for them to do. Make it easy for them to get vaccinated. They get paid time off now. I think the province has passed legislation to allow them to do that. So they can go during working hours. If you provide information about where they go, how to register, when they're supposed to go, when their age group comes up, encourage them to get the vaccine, then that makes it easy for them. And they understand that this is something that you are promoting for the workforce generally. So you can post locations, but really everything's on the BC government website, and there's a link in the guide to that as well. So those are the things that you can do to promote the vaccine. And you can talk as well about, I should have mentioned this earlier, when you're talking about the benefits and showing the evidence of how well it's working and how the numbers are going down, talk about the other side of the coin. The fact is, we are not going to get past this pandemic until enough people are vaccinated that the disease will no longer continue to exist. So the reason why China is back to a relative normal, Australia, New Zealand, places that actually had infections and high infection rates, is because they were able to contain the virus itself. So you do that through the safety protocols, the restrictions, the social distancing, the hand washing, the masks. But the most effective means of doing it is obviously getting vaccinated. So even though there isn't evidence to show that the vaccinations prevent transmission of COVID-19, there is enough evidence to show that it prevents people from getting it themselves, or at least if they get it, not getting a severe case. So you can restrict access to high-risk work locations. So if you have a shelter, for example, or a congregate living facility, or a cafeteria, or any location in your workplace where you will have your workers working in close proximity of either each other or your customers, clients, residents, whatever, then you can restrict access by unvaccinated people to those work locations. And you do that through a mandatory vaccination policy. If you want to have one for those locations, you can. So I'll talk about that later, but not to be confusing, you can restrict access to work locations for people that have not been vaccinated, okay? Especially if there's an outbreak or if there's an exposure. You can prioritize vaccinated employees for return to work. So if you've laid people off and you're bringing them back, then you can bring back those people who have been vaccinated before others who haven't. And that's especially true for workplaces, like I mentioned, where people are working in close proximity to one another. You have to remember that if you're going to be seeking information from people about vaccination or test results or anything that has to do with their medical condition, that you need to protect that personal information. It is their own private information, and it's very important under government privacy laws, which you all follow anyway, to protect that information and make sure that it is only used for the purposes for which you are collecting it, for the time for which you're collecting it. So if you're testing, or if you're screening, or if you're demanding proof of vaccinations in any way, then you need to be able to what's the word? Show people, demonstrate to people that you are protecting their personal information, and make sure that they know that. So can you ask for proof of vaccination? So that again, that's going to be information about a person's medical condition. And whether an employee has been vaccinated or not, you can ask for proof if you need it for the purpose of workplace health and safety. You have an obligation as an employer to ensure that your workplaces are safe and that your employees are healthy. So that means that you are minimizing the risk of transmission, exposure and transmission of COVID-19. So you can do things like health checks, temperature screening, send people for testing if there's been a risk of a known exposure. You can do things like that. You can also ask for proof of vaccination, but you have to be mindful that there will be people who cannot or refuse to be vaccinated for a very valid reason. So in that case, you need to be mindful that human rights legislation applies in those circumstances. And if, for example, somebody cannot get a vaccine for a valid medical reason, and you become aware of that reason, you need to protect their privacy, obviously. But you can't expect to have proof of vaccination if somebody is not able to get the vaccine. And there are valid reasons and there are protected reasons under the Human Rights Code. And I think Brayden will probably cover some of that off. So I want to talk just a bit about a mandatory vaccination policy. So there are situations where such a policy would be justified. And those are cases where a workplace has, as I said, an inability for people to be able to distance from one another. For example, a homeless shelter or a residential care home. Any of those situations, then what you would want to do is take a look at creating a policy that applies strictly to those workplaces and to those workers, and applying it consistently if you're going to do that. So it may make mandatory vaccination necessary for some of your workplaces and some of your workers. So you need to make sure, if you do this, that the policy is reasonable. It's very clear in its purpose and its intent. And then you need to apply it consistently. You also need to give people advance notice, almost as if you were giving them notice of termination. You need to give them as much sufficient advance notice that they are able to get the vaccine, because especially today, some people at a certain age group are not able to get vaccinated because their time is not there yet. Some people are resisting for medical reasons. Some people are resisting for religious reasons, all of which are protected under the Human Rights Code. So in those situations, it may be necessary for you to accommodate those employees by relocating them to another work site if possible. If you're able to have people work remotely, then do that. That's good. But I guess the point is that, first of all, you need to really make sure that it's reasonable in the situation, it's necessary, and that you are only enforcing it for reasons that are very clear to your workforce. Okay. So the legal framework for employers is basically, I'll just get to that, hold on a second. The legislation that affects you as an employer is, of course, the BC Employment Standards Act. And that act sets out provisions that protect workers' rights and provides them in terms of their pay, their hours of work, their job protected leave due to illness or injury. And the province has just introduced time off, paid time off, because not all industries have this, for people for the purpose of being vaccinated. Just looking here. So another piece of legislation that's very important, obviously, is anything under the WorkSafe BC that has to do with BC's occupational health and safety standards. That is an incredible resource. The BC, the WorkSafe BC site is an incredible resource for anything that you want to know about applying policy and creating policy in your workplace. It's also a great place for resources for posters and other information that relates to the workforce. And then you have the Human Rights Code, of course, that provides all of the protections to the individuals against discrimination and harassment. And you need to be very cognizant and mindful of those provisions if you're going to mandate either proof of vaccination or vaccination policy in any way. The Federal Quarantine Act is the act that has been forcing us to quarantine in cases where we may have been exposed to the virus, and also travel related. And the Personal Information Privacy Act, PIPA, applies, as I said before, and is a very important piece of legislation to take into account if you are collecting information in any way about COVID-19 from your employees. The other things that apply are your collective agreements. You need to get your union on side if you're going to be mandating anything that has to do with workers' rights, terms and conditions of employment. And then case law, I should say in terms of labor law also applies. So any arbitrator rulings would be setting arbitration precedents in a way for unions, and they would be looking to those decisions and rulings when dealing with you. So it's important to keep abreast of those. And case law. So Brayden's going to talk a bit about that. We haven't had a lot of cases come forward, but obviously we are expecting that there will be quite a few challenges to actions that employers have taken with respect to their employees during the course of this pandemic. I'm just going to give a little shout out to HR Insider, which is a resource that I use a lot. And they are a platform that's based in Penticton, BC. And they provide all kinds of HR support policies, and they do have lots of information about COVID and your rights as employers. And they also have a sample mandatory vaccination policy that you can reference if you're looking at creating one. So we will have time for Q&A, but before we do that, I'm going to pass this over to Brayden. And I'm going to mute myself. And if you have any questions, please don't hesitate to pose them. Over to you, Brayden.
Awesome. Thank you, Marsha. I hope everyone can hear me all right. I wanted to say a huge thank you to BC Nonprofit Housing Association for inviting me. I think Marsha called me an expert. That's certainly very generous of her. And, you know, Marsha did so much work on this and a lot of work in the guide. So I'm just grateful to chime in a little bit here and to add something in terms of the tenancy relationships. I saw the final version yesterday. It looks really great, and I think will be a really good resource for all of you. And I wanted to point out on this first slide here, this is Lady Liberty. She's wearing her mask. Even Lady Liberty is wearing a mask these days. It was actually a great picture, I think, for two reasons. One, and this is kind of part of what I'm going to be talking about, we're probably not likely to be doing away with masks, even though we'd maybe like to in some cases. And a lot of what I'm going to talk about is, you know, kind of staying the course with a lot of the prevention methods that you're already doing. And so I guess I encourage you that, you know, don't let the temptation of this being kind of close to over. As Marsha said, we're getting close to that point where more and more people are getting vaccinated. Don't let the temptation of us being so close to that make you make a quick decision, or, you know, a decision that you haven't carefully considered the rights at play. Also, the picture has the scales of justice in there. And you'll know from Marsha's presentation and mine as well, this is really a balancing exercise, right? So you'll have obligations and rights as a landlord, as a housing provider, and then the individuals will also have rights. So it is very much a balancing exercise, and I encourage you to consider that in any sort of decisions you're making or interactions that you have. We'll go to the next slide there, Marsha. So there's a lot of legislation and factors at play. It can be quite difficult to situate yourself in the right place. So I do recommend, you know, talk to your lawyer about kind of where you're at, what legislation applies. You know, each of these areas I'm going to talk about could probably be an hour presentation on its own. So I'm just going to try to touch on these at a high level. For sure, reference the guide. I think it's really useful. It has up-to-date links that you can use and should hopefully make things more clear, but I'll try to touch on some of these things at a high level. So next slide there, we have the legal framework. I included this picture. I think this kind of accurately depicts what my office looked like about a week or so ago. Preparing the guide, you know, I thought, how hard can it be to summarize what's at play for landlords? And sure enough, there's lots of things at play. I do tell you though that I did not have this many people in my office. I was respecting social distancing, so don't worry about that. But you know, I found, you know, even looking at this picture, sometimes I look at other things. You know, it is strange to see people so close again, and I hope we can get there. I think we're getting close. But I included this to show you that there are a lot of different things at play. As I said, the guide has links to these, which I think will be helpful for you. Legislation isn't always worded the most clear. I sometimes wonder if legislators, you know, make it worded in such a way to make it fun for us lawyers. I do find it fun to kind of figure it out. But yeah, again, I encourage you to speak to a lawyer if you're confused about what it maybe says or doesn't say. You know, one benefit of this time that we're in is there's lots of information available to you. And that's why the guide, I think, is so helpful for you, because it helps, you know, narrow the focus to the materials that will be most useful for you, that'll be regularly updated. Not that your Facebook or other feeds can't give you some articles too, but I think this gives you kind of the important documents and places where you can get your information. I'll do the next slide there, Marsha. So just at a high level, some areas that you're going to want to pay attention to. Obviously your contracts, that's really the foundation of any relationship at law. If it's employment, you know, tenancy, a contract relationship, what does the contract say? It could be policies, some oral terms. You might have multiple agreements that cover different parts of your operations. As Marsha mentioned, unionized, non-unionized. You could have tenants in different facilities. Start with these, right? Start with what they say or maybe don't say about rights and responsibilities. For this issue, it's pretty likely that these don't say a whole lot about vaccination, but it's possible that these have some additional rights or obligations. So I encourage you always kind of start with your contracts. What do they say? Also wanted to point out to you, there's these duties of care that you have, at common law based on the cases, as Marsha kind of talked about. You have these duties to ensure your premises are safe, comply with safety and housing standards. You've probably heard of these things, and these are the areas where there can be some liability even apart from COVID if you don't meet that reasonable standard of a landlord. So we don't have any cases, as Marsha noted, quite yet dealing with specifically COVID and vaccinations. A lot of these negligence cases are to do, they kind of involve insurance and, an injury incurred by a tenant on the premises where it wasn't safe and whether the tenant had some responsibility for that. So we're quite technical and, as of now, we don't really have any instruction from those cases as to how that would relate to vaccinations. But, it's a good point to mention that, these cases, they'll develop over time, right? So you need to be familiar with those, aware as things happen. We tend to see in law, things in Ontario developing more quickly. I know there's some arbitration decisions kind of coming out about mandatory policies. And so we typically kind of see it flow east to west in terms of the law developing. And in terms of tenancy, in comparison to employment, I expect there to be a lot more cases about the employment relationship than tenancy per se, but those employment cases will probably inform kind of where things go. We'll go to the next slide there, talking about the legislation. So where a contract doesn't say a whole lot, or even if it contradicts some legislation, it might be unenforceable. So you need to know that legislation that's at play. A key issue for a lot of nonprofits will be to navigate balancing, as I kind of mentioned in that first slide, individual rights of tenants, including tenant privacy and human rights. Those are kind of the main ones. Marsha touched on those. Protected grounds would include, religion, medical or physical disability. You always got to be aware of that. Also, privacy law, it insists you can gather information in certain circumstances, but generally, you have to gather that information as minimally as possible and use it as limited in a most limited way as possible. And so it's also important to know with legislation, certain legislation will apply to your organization and it might not apply. So for example, in the Residential Tenancy Act, assisted living and long-term care facilities are not governed by that, but independent living facilities would be. So important to know where you stand, what legislation covers your operations there. And you'll see a bit more about that in the guide, but again, good to check your specific circumstance. The next slide there talks about orders. I did want to just highlight one order, which I think kind of brings together what I had said about these duties of care. The ministerial order last year, there was one that was passed for essential services. And, it included some service providers such as, nonprofits that provide care, food, shelter, social and support services. And it basically said that, a person is not liable for damages directly or indirectly from being exposed to COVID, if they were operating or providing the essential service in accordance with applicable public guidance, or reasonably believe that you are operating in compliance with the essential service. So what this all means is basically that this legislation provided a bit of a higher standard of basically gross negligence in the essential care provider area. So as I noted, I think this was an indication, at least from a government and legislation perspective, if you're on top of these things, you're acting reasonably and you're doing your best, they're certainly trying to create some protection for you from any sort of liability. So these types of orders are temporary, so you should be aware that those things might expire at a certain time when this is hopefully behind us sooner than later. But that's just an example of an order that it would be important to be familiar with. Again, just an encouragement for you to do your best. On the next slide, I just kind of summarized the key points, again, a little bit more in the guide, but basically review your specific situation, many of your obligations and principles, and this will in the following slides be a lot of refresher and a lot of reminder to you. And I'm sure all of you are already doing these things, but a lot of your obligations and principles remain the same. The vaccination adds an interesting layer to that, but I definitely think the message that I'd like to communicate is, educate yourself on the issues, read the guide. Marsha did a great presentation on an overview. So think more about educating and encouraging rather than necessarily requiring. Again, in certain circumstances, it may be possible to, but I think the focus being on educate and encourage would be helpful. As I mentioned many times, balance those obligations with the individual rights. I mentioned this, don't become the test case. I think there's a tendency, as I said kind of earlier, to act quickly or to make a quick decision. But you probably don't want to be that provider that's in the news or something like that, that's embarking on new territory, at least without maybe some advice from a lawyer that would be okay. And so I don't think rush to any decisions or implementation. It'd be good to carefully consider your options and any sort of changes you might be thinking about. The next slide I just mention is some of these practical things you can do, and Marsha mentioned a lot of these already. You want to educate people, review the guide carefully. The BC Housing website is a really great resource. The BC government also has a COVID-19 and tenancies webpage, and that's linked in the guide as well. And that provides landlords and tenants with lots of information about rights and obligations. I won't go through all of that, but it's regularly updated as well, as Marsha noted. Sometimes these things change the day of. And so we're constantly learning. And so it's good to be familiar with those, check those out every once in a while. And I did note as well in this section, there was a document published in the spring of 2020 by the National Collaborating Center of Environmental Health. In consultation and concert with BC Centre for Disease Control. I put a link in there. And that outlines obligations and suggestions for keeping multi-unit residential buildings safe. Now, spring of 2020, that was before we even had vaccines in place. But I think a lot of those suggestions for keeping these places safe, health precautions, I'd really commend that to you to review. It has some really great information in there. And, just some on the more practical side, include signs, posters, and common areas where you can, provide information in your conversations where there's the opportunity to, again, just give them provide the opportunity for people to be more educated, I think is a really good approach. On the next slide there, I just talk a bit more about common areas. You got to control the spaces in your buildings that you can control. So this would include hallways, lobbies, stairwells, elevators, other common spaces. So you can, in certain circumstances, for example, enforce mask wearing there, and keeping in mind, as Marsha noted, some exceptions and duty to accommodate that might arise under the Human Rights Code. So keeping signs and posters in these areas would probably be advisable. And you are able to reasonably restrict or schedule common areas, keeping in mind you can't, in the residential tenancy context, interfere with someone's access to their rental unit. So temporary restrictions on certain common areas would be reasonable, as long as they're protecting health, safety, and welfare of the landlord or tenant due to COVID, complying with an order. So that's why I mentioned before, be familiar with those orders and what they say, and to follow guidelines that the BC Centre for Disease Control or Public Health are providing. So those things change from time to time. So do your best, refer to the guide. Again, that's hopefully a helpful resource for you to get the latest and the most up-to-date information. The next slide, I just wanted to mention cleaning, of course, that, as I mentioned, that document that was published last year, I think is very helpful. It outlines some, suggestions for keeping things safe. You guys are probably experts in this already, having done this for, it's hard to believe, about a year now. So just reiterating that there's other ways in addition to, the thinking about vaccination, that we still continue these other things. And it's still important to keep doing these things because I think they will also help. The next point I wanted to make was just kind of about policies and contracts. Marsha covered that really well already about, if you're going to make any changes to your policies or to your contracts, talk to a lawyer to see if it's going to be possible to do that, first of all, and then also to make sure that when you do it, it's going to actually be enforceable, that the person's had, adequate time, or if the case dictates it, they've been provided with something of value for it to be enforceable. So that's, yes, it can be quite technical sometimes on the implementation side, but it's an important point. For example, on the employment side, I've seen contracts now, almost all of them kind of mention something about a temporary layoff, and most contracts contracts previously didn't really talk about that or consider that. But I think the pandemic has created, a new issue for employers to consider, and thought, wow, we might actually be in a position where we have to lay off some employees. And so putting that in contracts, again, carefully so, and maybe moving forward for new hires is just an example of something to be aware of and to think about as potentially a way to provide more clarity moving forward. On the next slide, I just reemphasize this is a section kind of from the guide about minimizing risk, the distancing measures you can take, engineering controls, administrative controls, PPE where it's applicable, I think would be, important practices to, again, keep doing, as people are being vaccinated more and more, we hopefully don't have to rely as much on these other things. But I think for the time being, as this rolls out, as we get more information from government and directives about, the effectiveness of it and other information, hopefully these things are not as important, but kind of as we stand now, we're still in kind of an uncertain time in terms of how quickly we'll be able to move towards more people being vaccinated. So just some practical things again in the guide, reminding to avoid physical contact where possible, and some floor markers, occupancy limits in elevators or common areas, and again, more information in the guide about those types of things. But I think that those are important things to always keep in mind and to keep doing. I know it's been probably longer than a lot of us thought it would be, but I think important to kind of keep going with those. Even though it seems like we're making some progress here with vaccines. So the last point I was going to just touch on was this bit about incentives. I've had some questions about this, and there's not really any clear directive. So you're going to get a bit of the lawyer answer here in terms of, is it possible to do this? And I heard someone say, I think a lawyer's favorite 3 responses are, it depends, yes and no, and not necessarily. So those are kind of the answers you get sometimes. They're not necessarily as clear as you might want them to be. So there's no specific cases or directives, but I have read some articles that talk about incentives potentially creating differential treatment between different groups. And so if someone has a human rights issue that prevents them from being vaccinated, you just probably want to be careful about that if you're treating different groups differently. And so, I think these types of ideas, again, this might be a case where you pay close attention to another group that might decide to do this and see if it works and see if that gets challenged. Maybe don't want to be the organization that's the first one out there to do this, and it may work. It may work just fine. A lot of these cases, and a lot of what I'm saying is just to say, minimize risk as much as possible. Not to say that the things couldn't maybe be implemented, but you should probably be careful and at least consider those, and be aware that if issues arise, just to be prepared for that. So I think that's just one point I wanted to make on that. And then I wanted to kind of conclude again with my reiterated points from earlier, the suggestions for landlords, review your situation. A lot of your obligations are staying the same. They will continue after this is behind us, hopefully sooner than later. Educate yourself, balance those obligations as best you can. And I think you'll be in a good spot if you don't rush to any decisions or to implementation, and carefully consider all those things. So I think that was all I mostly wanted to say. I really appreciate the time to share with you all, and I'm sure there'll be maybe a few questions. I will try to avoid the it depends and the yes and no and not necessarily, but I'm certainly open as well if you want to contact our hosts to give my contact information to answer any follow-up questions or anything you might have. I'd be happy to do that. And thank you for joining us and for participating. I think Jackson was going to hop on here and maybe facilitate.
I just want to say thank you so much, Brayden. We didn't give you a lot of time, but I kind of figure you probably have a lot of the questions.
Oh, yeah, that's okay. No problem at all. Like I said, I feel like you did most of the work here, and I was able to add a few things, hopefully provide more clarity than confusion. That's what I hope for anyway. So yeah.
Hey, Jackson, what have we got for questions?
Well, first of all, thank you so much to both of you. That was a great presentation, really informative, and I think a lot of folks are going to get a lot from it. So informative that we actually don't have too many questions, so we may end a little bit earlier here, but I do have a couple. The first one is around just kind of the balance between safety in a workplace and avoiding vaccine discrimination. It's kind of an unanswerable question, I think, but it's more just how do you make that balance work, and where's the line to draw between discriminating against people who have not been vaccinated for their own personal choice and for trying to protect your work environment. So maybe either of you can speak a little bit to that.
I just make one comment and I'll let Brayden cover the legal aspects of it. You can't do something about something you don't know about. So if an employee has an issue and refuses to disclose, then you as an employer, and you know this generally, if there's a work safety issue, you can only manage those issues when you are aware of somebody's safety concern. And in this case, it may be under a protected ground in the Human Rights Code. So I think that you really need to think things through if you're going to be requiring any form of vaccination, temperature checks, screenings, all of those things, even though they are promoted and endorsed by the province. You really need to think things through, as Brayden suggested, to be able to balance your obligations for health and safety against the rights of the individual. So, and I'll let Brayden speak to the legal issues, but from my perspective and knowing what you do, you're going to have workplaces and locations that are going to be higher risk naturally, because you're going to have people that work in shelters who are going to be exposed, have work in very close proximity. They're going to be emergency situations. It's going to be very difficult to isolate people and socially distance. So you really need to measure the health and safety aspects or obligations that you have as an employer against the rights of individuals in that situation. And I would think that, and we don't have any case law yet, but I would think that the courts will ultimately rule on the side of the employers who have thought things through, who take measures to protect people, and who safeguard the information of those employees when they're asking them for private medical information. Brayden.
Yeah, no, those are all good points, Marsha. I think all that I would add, maybe not so much from a legal perspective, but just a practical and pragmatic approach is, how you deal with your employees or your tenants. How are you dealing with them? Is it in a respectful way? Do they feel like they're being listened to? I mean, everyone's under a lot of stress. So a lot of these human rights cases that I see, not necessarily so much yet in the vaccination context, have to do with, maybe a disconnect in communication, or things escalate such that the person feels like they're not, being treated fairly. So it's more of a practical, consideration, of course, within the context of your operation and your organization. You want to be communicating reasonably. I think, as Marsha said, we're seeing, as some cases trickle through that, arbitrators, if the employer is acting reasonably and in the circumstances, is doing what they can, relying on their best information, that order I talked about, right? If you're trying your best, you're in a much better spot with all of these things. It's a tough thing to balance sometimes, right? So yeah, it's maybe not as a clear-cut an answer as you'd maybe hope, but I think, yeah, definitely you just want to, your approach, I guess, is what I'd like to say is sometimes as important as whether you have a legal right to do so or not.
Great.
Thank you so much, folks. That's we've got a bit of almost a follow-up question. It's certainly related from somebody in our group here. Someone's had a residence council member say that they'd like to throw events in the future, but only for vaccinated tenants. And so they understand that that's discriminatory, but they don't know how to really navigate that. It's definitely related to what you just spoke about, but I wonder if there's anything else you want to add that might add some clarity to, whether or not that's allowed, or how that might be navigated.
Yeah, it's a good question. I mean, yeah, I think it's it's one of those things where, it's these are really good questions. I think that it's tough sometimes to balance those rights, I guess, is what I was trying to say before as well. And I guess how you communicate them in the circumstances. It may reach a point where it's, you have to make that decision one way or the other. And what I like to tell clients is you want to have, like I said, kind of that backstop, or that internal file that shows that, for example, you've considered this carefully. you've been considering all these issues, you feel like in the circumstances reasonable. It hasn't been a rushed decision. So I like to say in any sort of human rights issue, you definitely want to be careful and show that, you've asked for the appropriate information. And I think that's one misconception probably in human rights that I hear commonly, right? Oh, we can't even ask an employee, if they're off, and it's like, well, no, you actually have a right as an employer to know that they're away, maybe not specifically for the medical circumstances, but I know it's all, you want to be more careful than not, but there's a phrase in employment law, accommodation is a two-way street. The other person has to provide you with information so that what you're dealing with. So I think that's something to keep in mind as well. Again, how you communicate is super important.
And I didn't cover this, but in the guide, I talk about opinion, polls and opinion. And Canadians are largely in favor of things like vaccination passports or proof of vaccination, because I think, well, it hasn't been tested, but you're probably going to see certain industries refusing access based on vaccination, just like you cannot travel to certain countries unless you have been vaccinated against the diseases that are prevalent there. You will not be able to do things in future unless you can prove that you've had a vaccination. We also don't know whether or not vaccination is going to be this one-time thing or ongoing, like a periodic into the future, like we have with flu vaccines. I would suggest we are going to be getting boosters as we go along. Yeah, it's going to be a very interesting time. None of these things have been tested. And as Brayden said, you don't really want to be the test case. And you may end up being that test case, but if you are, you want to make sure that you've taken all of the measures, to make sure that the actions you take are reasonable, they're well thought out, they're timed properly, they're implemented properly, and that you provide people sufficient notice and information for them to be able to make informed decisions.
Great. Thanks so much. I think we've got just a couple of more here. Some have flowed in as you folks have been answering those first two. There's one around enforcement. It says, I think we can advise tenants of the requirement to mask in common areas, but the term enforce was used. Mm-hmm. And the person asking the question says, our understanding is that you could not require proof of disability. So there's no way to actually enforce wearing masks in halls and lobbies. Can you talk a little bit about the powers to enforce mask wearing, whether or not that can really just be an advisory or whether or not there are actual kind of ways to enforce that?
Yeah, no, it's a great question and a good catch there on the word enforce. I think I said, where it's applicable. So I used one of those lawyer terms, where applicable, and then keeping in mind the human rights code exceptions. But it's a great question. And I think the answer is really, in common areas in certain circumstances, you can. And maybe enforce is the term that maybe is confusing. You can have that requirement in a common area, but if someone then says in response to that, I can't wear one because of disability, and I think the question is asking about, proof of disability. The person, I guess is what I'm trying to say, is that they would still have to give you that information. So it wouldn't be a case where across the board, you wouldn't be able to say, well, that's not our kind of policy to have that. But then within that framework, you might have individuals who say, for this specific basis, I have a medical disability or whatever, then that person may be provided with an exception. So I appreciate that sometimes feels frustrating, or that feels like we can't enforce it all. But I think I would say that there's definitely more cases that you could, but there might be people who raise an issue with that. And then, yeah, you might have to accommodate that, if that makes sense.
It's about public health and safety. It's about workplace health and safety. And that's where the encourage and inform side comes in. But you are going to have people who resist and who they verbally and publicly resist. They're trying to make a point. I think as employers, your obligations override that. So if somebody is unwilling to share with you their reasons why they will not wear a mask, I think at the very least, you have a right to deny them access to that particular area. Personally, I don't think that, the courts are going to rule in favor of somebody who's going to put others in jeopardy. That's my personal opinion. I think you may start to hesitancy rulings, the arbiters in labor situations, and by the courts. As I said, we don't have a lot of experience yet in terms of how courts will rule or tribunals will rule, but so far it looks like they're willing to err on the side of public interest.
Yeah, I would echo that. I think that's what I've seen, or that's what it's been hinted towards in terms of the human rights tribunal cases as well. We are in a health crisis, and so there will be some, I think, latitude provided, again, if you've acted reasonably, taken time to consider. You're doing your best job, right? The best job you can. You're not making a quick decision or impulsive decision, or escalating a situation like Marsha said that maybe is difficult. You're trying to be reasonable, trying to be fair. You always want to be in that position as the landlord or as the employer, being the one who's being reasonable and communicating clearly and calmly. So that kind of stuff always helps, I think.
Great. Thanks again. I think we've got just one more question here. There may be some more that pop up while we're answering. And to anybody listening, if you do have any other questions that are burning and you want to get them in, now would be the time. But this one is interesting, and it may generate a little bit of conversation. It's about landlords' obligations. So what are landlords' obligations when a resident has disclosed an infection to protect others? And what are approaches to take in that situation, such as, can you restrict access to common areas for the infected individual? How does that look?
Yeah, that's a good question. Yeah, so if someone has disclosed that and you're dealing with the common areas, again, keeping in mind that as a landlord, you have to allow that person still kind of access to their unit. So it kind of depends where the common area was, but perhaps you could create another route for them, or suggest another route to them in terms of dealing with that person. In terms of disclosing to others, that's always a tough one. You definitely want to protect that person's personal information, and the privacy legislation is very clear that medical information is very sensitive to an individual. So to the extent you can kind of deal with that without maybe disclosing that to others, dealing with the individual, it's a well asked question, because you do obviously have that obligation to keep others safe. And so it may be a case, kind of like I outlined, that you have more restrictions on common areas for that reason, for everybody, not just for singling out one person. You might just say, well, this is an issue here, and we're gonna not have so many people or any people in the elevator or whatever, right? So I think that maybe would be one way to think about approaching it.
Marsha, anything to add there? I think we're good to leave it on.
No, I think we covered it.
Awesome. Thanks so much. That ends the questions that we've got from our attendees. So I guess we'll get away with ending about 10 minutes early here today. Let me first just take a moment to thank you both again. This was a really excellent presentation, and I really got a lot from it myself, and I'm sure our housing providers got even more out of it. So thanks very much. And we'd also like to thank our attendees for their questions. And yeah, we really appreciate everybody coming today. As I mentioned at the beginning, we will be sending the link to this recording to all participants, and it will be available on the BCMPHA website for some time. I know a lot of folks may have joined late today, and so you will be able to see the presentation in full on our website. And so please just reach out to us if you have any trouble finding it. It'll be at bcmpha.ca/education/webinars. For more resources on COVID-19 and upcoming webinars, which will cover a full range of topics, please visit our homepage at www.bcmpha.ca. Thanks one more time to Marsha and to Brayden, and take care, everybody. All the best.
Thanks, everyone.
Thank you.